Okay, this is my audience. Most of us have taken medication at some point in our lives without ever thinking twice about it, whether it be for a cold, infection, or a simple headache. But imagine if that simple choice to take that medication triggered your body's immune system to turn against you. All of a sudden, your skin and mucous membranes are covered in deep burns and blisters, and you're being hospitalized for months. Unfortunately, this is the case for people who have been diagnosed with Stevens-Johnson syndrome. So today we will be exploring what Stevens-Johnson syndrome is, the causes and symptoms, as well as the treatments. According to the Medical News Today, the first known case of Stevens-Johnson syndrome occurred in 1922 when the doctors Albert Stevens and Frank Johnsons published a report on the condition they observed in two young boys. Stevens-Johnson syndrome is a rare skin condition that attacks the mucous membranes of the skin, causing blistering and burns. The burns are caused by the skin's epidermis separating from the second layer, the dermis. And right here I have a diagram of the skin anatomy, and you can see at the top is the epidermis, and the middle layer is the dermis. These burns cover the whole body and are extremely severe. These burns often require a stay in the ICU, intensive care unit. Some of the complications that can arise from SJS are sepsis, organ failure, and even shock. This condition can have someone hospitalized for months waiting for their skin to recover and regrow. According to the Cleveland Clinic, about 10% of people diagnosed with SJS die. Now that we've taken a look at what SJS is, let's dive deeper into what actually causes it. SJS is caused by an immune system overreaction to medications such as antibiotics, anticonvulsants, and anti-inflammatories. It can happen to any demographic of people, but is more common with people who have a weakened immune system, have gone through chemotherapy, or people who have already experienced SJS. Now, this diagram shows over a 40-year period just how many cases of SJS there are in blue. And this diagram shows over the course of a 7-year period just what medications have been the cause of SJS. According to the Great Orchard Street Hospital for Children, symptoms include the start of flu-like symptoms such as a cough, a sore throat, or a headache, skin rashes with a target appearance with the outer ring being darker than the middle, and mucous membranes in the eyes and throat are also covered with blisters and sores that can lead to permanent damage. And right here is one of the images of Stevens-Johnson syndrome. You can see that there are multiple spots all over the body and that the outer ring is slightly darker than the inner part. And this is also a more severe case. You can see in A and C, that's the start of it. And then B is when it starts to blister and pop. According to the National Library of Medicine, due to the severe nature of the injuries, Stevens-Johnson syndrome should be hospitalized. Oftentimes, patients will be placed into the intensive care unit or the burn unit. A common complication with SJS is dehydration because of the painful blisters within the throat, making it impossible to swallow water. Heat loss is also common because the skin's barrier is damaged so much it's hard to retain heat. Another complication is because of the membranes damaged in the eye, severe vision loss can occur. In this diagram, you can see the anatomy of the eye, and the conjunctiva is a membrane that surrounds the sclera or the white part of the eye, and then the cornea is the outermost layer of the eye, and those are the two parts that get damaged the most, which can cause blindness. Now that we have looked at the causes and symptoms of SJS, we can look at the possible treatments. Courses of treatment for Stevens-Johnson syndrome while in the hospital are the immediate halt of any medications being used. The reason they halt all medications is because they don't know which medication is causing the Stevens-Johnson syndrome and they don't want to further any more injury. And to help with fluid loss and nutrients, they place an NG tube because the sores within the mouth are so severe that it makes it impossible to eat or drink. Wound care, which includes a cool compress on all the blisters, and removal of dead skin, and putting a medicated dressing over all areas. And eye care is essential since the blistering can cause severe permanent damage to your vision. And oftentimes, after being released from the hospital, wound care is still needed. Since SJS, again, attacks the mucous membranes in the eyes, it's imperative that you can get continued care from an ophthalmologist. Therapy might also be needed since SJS can leave you permanently disabled and can affect your life deeply. Medication avoidance is also needed so that you don't have another SJS flare-up. In conclusion, Stevens-Johnson syndrome is a very serious and rare medical condition that needs greater awareness. Today, we have explored what Stevens-Johnson syndrome is, the causes and symptoms, as well as the treatment. Though Stevens-Johnson syndrome is uncommon, it can happen to anyone. Being educated on the medical condition and recognizing the early stages can make a difference. By further educating ourselves on SJS, we can help protect ourselves and others. And then here's my audience again. And that's it.